Hello everyone, I am Dr. RMD, Pediatric Resident at PGMR Dr. RMR Hospital, New Delhi, and this is the fourth part of Debunking the Myth series where we will be discussing INICET PYQs and then we will be applying it for revision strategy for the upcoming INICET exam. So the frequent question that I am being asked by the students is, should we study bacteriology or virology for microbiology when there is limited amount of time? So I'll say you have to modify both, okay, because the previous year data shows that, so previous 7 question papers, the highest questions were asked from virology. 27 questions were asked, even though it was one less more than the bacteriology. Bacteriology where 26 questions were asked, but still virology is around 60 to 70% of the total topics covered by bacteriology. Okay, compared to bacteriology, it is just 60 to 70%. So that makes virology very high yielding, okay, than bacteriology. Second, mycology, which is very small, which can be covered in few hours. That had there were 14 questions from virology, and every year at least 2 or 3 questions are definitely asked from mycology. So you have to give very much importance to mycology. And then comes protozoa or parasitology, where 21 questions have been asked, and most of these questions were image based. So when I was going individually through each questions in the previous question papers, I saw that many questions were asked from these egg images of parasites from the stool samples, okay, and then life cycle. So many questions were asked from this, which you can't lose, okay. If you lose that, then you are out of the race. And general microbiology, few questions were asked, and immunology only 10 questions were asked, and 2 years questions were not asked at all. So don't study immunology. That is my sincere advice, because whatever immunology you need, you'll study from pathology. Okay, in pathology, general pathology, immunology will be covered. So don't dwell much into immunology and microbiology. Whatever important is, I will tell, read only those things. Okay, so total 112 questions were asked in microbiology in the past 7 papers since November 2020 INICET. So this is one of the top 6 subjects which have crossed 100 question mark out in the total number of questions that have been asked. Okay, that we had already discussed in part 1 of this video. So what is the trend of microbiology? Microbiology, there is an increasing trend. So in November 2021, the number of questions decreased to around 12, but after that, the number of questions have been increased. In November 2023, 20 questions had been asked from microbiology. That accounts to 10% of the total questions asked in INICET. So microbiology is a very important topic, and since you don't have to study too much in microbiology, there is more of memorizing. So I'll tell you selectively what to memorize and what not to touch upon. Okay. So topic wise, if you see, this bacteriology along with mycology and virology covers almost 75% of the total topics, these 3 systems. Okay, immunology, I said you don't go to study from microbiology, and parasitology also you have to touch upon certain topics only. Okay, general microbiology, I tell you what to study. So this is the topic wise distribution. So coming to what are the clinical and image based questions, see here. In clinical question, bacteriology had highest number of clinical questions because these are case based. They'll give a patient came with so and so complaints, and then which is the pathogen that is implicated in this. Okay, and even mycology had, out of 14 questions, 6 questions in mycology were clinical based. Okay, viral, less number of clinical questions, and protozoa also less number of clinical questions. But in image based questions, highest number of image based were asked from parasitology, 13 questions. This doesn't include this life cycle. Life cycle 2 questions were asked that I have considered separately. These 13 questions were mainly based on stool samples. So this how the each egg shapes appear in the stool microscopy. So this stool microscopy part is very important, very important. Then viral 7 questions, and bacterial again 11 questions were asked, and these questions were based on microscopy of viral, this one. And general microbiology also 3 questions were asked mainly on microscopy. Okay, so in microbiology is the contains the second highest image based questions. First was anatomy, where 51 questions were asked from image based in the last 7 years, and microbiology total 44 questions were asked. So microbiology today itself, go to the image bank and by heart all the images. I'm telling you to by heart all the images because it is so important. Just by seeing the image, you should be able to arrive at answer. 44 questions out of 110 questions. No? Yeah. Total 112 questions. Out of 112 questions, 40, that accounts to almost more than 30%. Okay, around 35%. So coming to a very important topics, this is in general microbiology. You have to mainly focus on microscopy and culture, where 8 questions have been asked. Virulence and toxins, virulence factors, all these 4 questions were asked in the past 7 years. Staining and fixation, sterilization and disinfection, 4 questions were asked. So these are the main topics where questions have come from microbiology, general microbiology part. And then coming to immunology, again only study type 4 hypersensitivity reaction for some strange agent. 3 times this question was asked. Antigen antibody reactions, MHC, antigen presenting cells, but don't study more because you will be covering this in patho as well. And then coming to bacteriology, the most important, which is the bacteria that has been asked the most, it is E. coli. E. coli has been asked around 7 times. Okay, so 7 times E. coli has been asked. Means every year, every question paper, one question will definitely be based on E. coli and the various variants of E. coli. Okay, EHEC, EPEC, ETEC. Then scrub typhus also has been asked, and this scrub typhus is not is actually a rickettsial question. So you should be knowing that table, that pearl or treasure, where rickettsia, different species are given, different vectors are given, and different diseases are given. So that is the most important table in microbiology. So this rickettsia, see again here, infections from rickettsia, again one question was asked. So totally 4 to 5 questions have been asked so far. Okay, actinomyces, 3 questions have been asked. 3 questions from actinomyces. Leptospira, Clostridium, all these 2 questions were asked on, even on infective endocarditis. And few questions have been asked from gonorrhea, Neisseria gonorrhea, Neisseria meningitis, 2-3 questions have been asked. Cholera, again questions have been asked. Okay, Shigella questions have been asked, and then pneumococci, 2 questions have been asked. Okay, so these 7 to 8 bacteria which I told now, you should be knowing at the tip of your tongue. These are the bacteria which will be asked repeatedly. Okay, and in the upcoming INA also you will find at least 4 to 5 questions based on these bacteria only. Okay, next coming to viruses, this is the order that you have to follow. Hepatitis B is the most frequent here, then HSV, HPV, okay, then microscopy and culture of viruses, EBV, COVID, Ebola, Zika, rabies, it goes in this order. So at least these top 10 viruses you should, top 10 viruses. Okay, so based on this you can actually, you don't have to study everything, you can just selectively study each topic. Okay, so coming to mycology, again aspergillosis is the most commonly asked, mucormycosis, subcutaneous mycosis very frequently asked, especially image based, especially questions on subcutaneous mycosis. Okay, where there is a rose, thorn, prick. Okay, so these questions are repeated, sporothrix, Schenke questions. Okay, asteroid bodies, all these are frequently asked. Mycoplasma actually should come under bacteria, sorry. Then Candida, Cryptococcus is also clinical based questions are asked, and classification of fungi 1-2 questions are asked. Microscopy and culture of fungi also 3 questions are asked. So follow this table. Then coming to parasitology, most important is toxoplasmosis. I think one life cycle was also asked from toxoplasmosis. Kala azar, hydatid cyst, cryptosporidiosis, cysticercosis. These 5 are the top 5. Okay, then Ascaris. Then coming back, you will also have to study this malaria. Malaria has been asked and amoeba has been asked. These 5 to 6 parasites are asked repeatedly. So that doesn't mean this year also definitely one of these will be asked. But other than this also some questions may be asked. That is not under your control. But what is under your control is studying this. You can't miss this. Okay. So how to study microbiology? First, don't study immunology. That is my sincere request. Don't study immunology. Okay, and study immunology only those points which I have already told you. Okay. Then clinical bacteriology. It is not just bacteriology. Study clinical bacteriology, because clinical type of questions are asked from bacteriology and image based questions are asked. And images in mycology and parasitology are very important. So microbiology is half about images, okay, and half is about how you balance each bacteriology, virology and mycology. Okay, so it has mainly memory based questions, but then again I think image based questions should guide you. Image based questions you shouldn't make mistake at any cost. Okay, because if you study microbiology well, it will help you in infection part. Okay, then infections are like in medicine, infection, pediatric infections. Okay, these infections have the highest weightage in those subjects. So if you study microbiology properly here, that will be very helpful for you there. Okay, so next we'll be discussing about surgery. Okay, in the part 5 of this video we'll be discussing about surgery. Thank you.